and I'll give you the key. It's easy. Just keep on hopping, keep on rocking, and don't start stopping. Everything you need just to walk the scene. And if you wanna make it better, you give it to me, I'll grease it. I believe for you, you wouldn't believe what I see in you. So don't stop, don't let the dream drop off. Hold up and make it lovely, make it real, and make it yours. Don't stop.
Dr. Joy Kong, I'm so excited to have you on the podcast. I have been dying to have a podcast about peptides, and you're going to give us the best of both worlds because we're going to talk a little bit about peptides today and also stem cell stuff, which is really awesome. So I'm really excited to have this talk with you today.
Oh, great. Thank you so much for having me. I'm excited to chat with you.
Well, I guess I kind of get started with every podcast by hearing a little bit of your background so our listeners know where you came from and what got you into this stuff.
Okay. The background started a long time ago because I, growing up in China and having the access to both Chinese medicine and Western medicine kind of gave me this sense of respecting both worlds. And then I came to the US and studied medicine at UCLA. I went through my own transformations as far as, a little bit disillusioned when I was in medical school because I felt there was a little bit of a double standard when it comes to Western medicine versus Chinese medicine because, a lot of times the rhetoric against Chinese medicine or other traditional therapies was that we don't know how it works. So even though it has been shown it works, but they don't like it because they said, well, we don't know how it works, and that was an argument against acupuncture. And then I realized in my pharmacology class that's what's often the bottom line for all these drugs is the mechanism unknown. I was like, why is it okay for you not them, and we're accepting it as a wonderful drug and well-respected therapy, but not for traditional therapies. So anyhow, so I went through my own stage of disillusionment, and then coming to respect Western medicine more, realizing, okay, yeah, it does have its own, a lot of merits, has a lot to give to the world. Unfortunately, when it excels at emergency medicine and trauma medicine, it really kind of failed us at chronic illnesses. So that's when I thought, okay, you've got to go back to looking at the body as a whole, because the way you're targeting the body, looking at reducing everything to a single cause, and that has not worked well. So I'm sorry. My cat is cat here.
That's so funny. So
okay.
Just to veer off of this a little, cats in this podcast have been a thing. I'm telling you, Dr. Shanahan was on my podcast and she had a cat war behind her one time when we were recording, which was pretty darn entertaining. But anyways, go ahead.
Yeah. So anyhow, looking at the body as a whole, and that is an ancient idea. So Chinese medicine's connecting different organs through the meridians, and that's just, that's how they look at the body. So that's when I thought, okay, so how can I bring the two together? But it's difficult to bring the two together because philosophically they're so much opposed. But I ran into anti-aging medicine, and that's when they were looking at traditional therapies, but with the eye of the scientific lens. So that was intellectually, it was satisfying for me because I could look at traditional therapies, but explain it in the modern science language. So from anti-aging medicine and regenerative medicine is part of the anti-aging medicine. Of course, we need to regenerate in order to not decline and get old and get sick. So stem cell therapy quickly came on, to the scene because that's stem cell therapy as a new field. It's more accepted in a new discipline like anti-aging medicine or holistic medicine, because they're already very open to new science, new evidence. But when you look at traditional medicine, which percolates down, you have to conduct a long-term study, and then the FDA has to agree with it, and then it has to prove it, and then slowly the doctors are aware of it. So if you go that route, it's going to take 10, 15, 20 years at least. So the new discipline like anti-aging medicine are embracing these new therapies right off the bat, right off the gate. So when new research comes out, these disciplines are saying, hey, look at these new research. We may be able to implement this. So that's what's exciting about the new form of medicine. Unfortunately, I think probably 98% of medicine practice in the US are still the traditional form. That even when people think they're getting hormone replacement therapy, but when they're doing it at Kaiser or getting it from their traditional medicine doctor, is so primitive and is so limited. It's just it's not the real deal. So unfortunately, people don't realize that. They think they're getting hormone replacement therapy, but they're actually getting just a tiny fraction of what could be done. So they are really and it's a disservice to patients. So that's how I got involved with this whole new discipline of medicine. I too was in a bubble. I call almost all traditional medicine doctors living in a bubble, because how can you not? Because you graduate from medical school, you choose a specialty, and then within that specialty, all your teachers have been taught through this whole system of medication, diagnosis, medication. Diagnosis purpose is to plug you into medications. And then you will do continued medical education, and they're all through conferences, and conferences are all sponsored by drug companies. So it's the same, and same as scientific literature. Unfortunately, nowadays, scientific literature, it's getting harder to trust. Even the chief editor of Lancet, one of the most prestigious scientific journals, said that he didn't trust published articles. The scientific research has degenerated, and also similar things were said by editor from JAMA. So it's unfortunate. So when you are kept in the bubble, then it's very hard to break free. And I myself didn't even know that people could do stem cell therapy until about 7 years ago. That's when I heard from another doctor. I happened to run into this more pioneering, spirited doctor, and he said, I've been doing stem cell therapy. I said, what? You can do that? So I don't blame doctors for being kept in a bubble, but if they happen to encounter it somehow, let's say a patient brought it up. I've heard so many patients of mine who told me that doctors simply just dismissed it, saying, well, you're going to be wasting your money. It's not going to work for you. No, there's not enough evidence. We're not there yet. They give one sentence sweeping statements without knowing anything about what's going on in the field. And that is unfortunate. So when they did come into contact with this new form of medicine, it's their responsibility to get on the damn computer and look up stem cell therapy and particular condition to see what's out there. And I bet you if they look, they're going to find it. And it's unfortunate that they don't.
Well, and that's one thing, also to note is that a lot of these studies that are now new, and you hear all these things, right? They really don't know for another 10 years what's actually going to happen and what's not. So when you see this emerging research, sometimes it's not really accurate.
Yeah, exactly. So that's kind of, my story of, getting in contact with this new form of medicine. And I just dived, head on, because I just thought this is really exciting. I can potentially transform somebody's lives, and I have many. I've helped people with severe COPD, getting off oxygen, getting off almost all drugs. People with liver cirrhosis, ending up not having a liver cirrhosis diagnosis. Of course, osteoarthritis and all kinds of autoimmune diseases like lupus and multiple sclerosis, different, traumatic brain injury, psoriasis, it just cardiac diseases is amazing, is wonderful, it's exciting, it's fun to do. I think medicine should be fun, it should be exciting. But unfortunately, I think the burnout rate is so high among physicians because they just they don't have the tools. So when you are in a state of overwhelm and helplessness, it's not a good place to be. And I really hope more doctors wake up and see that there's a whole way of doing medicine.
So let's back it up just a little bit here, Joy, and let's talk a little bit about what stem cells are and kind of the formula behind that, because I think a lot of people have heard of stem cells, or maybe they listen to Ben Greenfield and he talks about it. He's the big stem cell guy in the popular space for health, right? But let's back it up and explain a little bit about it and the mechanisms in which it works and all of that.
So I always go back to the origin. You and I all started as a single stem cell. So the fertilized egg has all the potentials, everything's embedded in its DNA, has all the potentials to become any cell in the body, right? So from that single fertilized egg, just imagine the massive amount of intelligence that's in that cell. Somehow it knows how to divide and migrate and start to differentiate and gaining new functions to form different structures, eventually forming a full baby, right? That's incredible. So as the cells divide, there are, until specific organ-specific cells are formed. So specific organs are forming. They're all stem cells, but they're all at different stages. So if you look at stem cells, it's almost like a ladder. You go down, you start to gain different functions, but they're still not tissue specific. But they are losing some of the potentials by gaining further functions. So it's like this rainfall all the way down, and they're all stem cells, but they have different degrees of ability to differentiate. Let's say because they have, like, when the embryo is forming, there are 3 layers: endoderm, mesoderm, ectoderm. So within each germ layer, that's when different organs can be formed. So the ectoderm, nervous system, the skin, and the mesoderm, the skin, muscle. So and then there's internal organs, a lot of the endoderm. So when you are looking at stem cells that are still in our body, you also have all these different types of stem cells in the body. We still have a lot of them, but we also, one thing I think it's prominent is tissue specific stem cells. So let's say your liver has its own stem cell, your cartilage has its own stem cell. So all your organs have stem cells that can regenerate itself. That's why, we can live for 80 years and we hurt ourselves and, the body can regenerate. But another type of really fascinating type of stem cells is called mesenchymal stem cells, or mesenchymal stem cells. So these stem cells, even though there's some controversy, some people say you can't call them stem cells because they don't really differentiate. Well, there's actually studies showing that they do differentiate, not only in petri dish, but also in animals' body. So they do differentiate. But I agree that the majority of how they work is not through differentiation, which means, becoming a cell of that particular tissue. It's through sending signals. It's through sending out signals throughout the body, talking to your immune system and talking to local tissues, and instructing them on how to calm the inflammation, and then start the repair and regeneration. So we have these mesenchymal stem cells all throughout our body. Anywhere you have blood supply, you have these mesenchymal stem cells. So they are actually, kind of hugging blood vessels. Anywhere you have the blood vessels, they're hugging it, and they are sensing what's going through the blood. And they are also sensing what's going on locally with the local tissue. So they have this ability to coordinate what the local tissue may need, or what the systemic demand may be. And they can squeeze themselves into the blood vessel if they sense a signal somewhere where they may be needed. They can swim upstream and find a place, and then get out of the blood vessel and start working. So these are very powerful cells, and they are right now the most commonly used group, mesenchymal stem cells. But there are also other types of stem cells, like hematopoietic progenitor cells. So they can form all the cells in the blood system. There's more in the bone marrow. That's why you have bone marrow transplant for blood disorders, because you can reconstitute the blood, right? The blood system. And so there's, there are many different kinds of stem cells, like endothelial progenitor cells that also are very important, or mononuclear cells. These are young primitive cells. There may be, different people may define them differently, but these are all very primitive cells, and that can differentiate in certain directions. So that's kind of the overview of what stem cells are.
So how can we benefit from them, and what's the delivery format? I'm assuming there's different ways to utilize them.
Yeah, so stem cells, you can use stem cells either from a person's own body or from a donated source. I'm probably one of the first person in the industry who's really looking at, okay, I want to provide stem cell therapy for patients because there's so much evidence of its benefits, but what's best source? So I went ahead and compared the difference between a person's own stem cells. So that's either usually from bone marrow or fat. You can extract stem cells from these sources, or the breast tissue derived stem cells. And there's also other sources. People can get it from menstrual blood and get from dental pulp, and there are a lot of different sources. But the most commonly used in this country will be, or around the world, will be either bone marrow or fat derived stem cells from a person's own body, or breast tissue derived stem cells. Breast tissue derived usually is from the umbilical cord, could be from the cord blood or the cord tissue, or the amniotic membrane, could be from the placenta. So, and when I compare these sources, looking at all the published studies, it's pretty clear to me that the breast tissue source is the superior source. They are younger. They have longer telomeres. They have longer lifespan, more generations left. They are more metabolically active. They can secrete more anti-inflammatory factors. They're more neuroprotective, and they also has less potential to cause cancer, because when your own stem cells start to work in the body, sometimes it tells everything to grow, and when the cells are older, somehow it may not recognize the cell as diseased and abnormal. And instead of telling it to die, which MSCs, mesenchymal stem cells, can do, they instead just tell everything to grow. And that's when you can have exacerbation of cancer. So to me, I have an obligation to provide what's the most powerful treatment and also what's the safest. So after the comparison, to me, there's no question that the breast tissue derived source is the best, because I was just facing the question of which direction should I go. I just want to give people the best. So I don't have any, I can get trained in fat, extraction, bone marrow extract, that's fine. But what is that the best for the patient? So that's what the different sources. But as far as the benefits, so looking at how the cells work, as we look at the mechanism of how the cells work, the stem cells are very anti-inflammatory, so they can calm inflammation. So let's just talk about MSC, since that's where, most therapies, that's what people are talking about. They're highly anti-inflammatory. And, not only most diseases have inflammation as part of the picture, but even aging. Even a normally aging, ostensibly looking vibrant, older person has elevated inflammation markers, even if they're not sick, and they're just normally aging.